I guess that's why also we're learning so much of everything that we're trying to do with the site is it's simplicity. It's like understanding all the inefficiencies in the system and like what people are gonna just be fed up with. It's probably the biggest thing that we're dealing with. But anyway, we're gonna jump right into it. Thanks everybody for joining in. This is an open, Google Meet. I was explaining to Marla as I just threw her into the fray yesterday, or 2 days ago, on this, and just mentioned that, while we're, on this one mission here to, collect all the videos, trying to get as many as we can, to make it more and more sciencey. Okay. When we're getting the data, from, which is in phase 2, we've been doing these, Johnny kicked it off before our last deadline, and now we've just extended it to, the extended deadline where it's dovetailing very nicely into a new initiative to basically have one-on-one phone calls out to a lot of our members. We got like 2,200 members, but maybe about 100 of the videos. I mean, I don't know how many different ways we could have possibly made videos and ways to see and repeat 1,000 times that this is a multi-step process. There are, processes here, but, we're learning, a lot about, I had no experience with Facebook groups and, and it's a relatively new thing, and phenomenon, which is a big part of how this is coming together and how this is so innovative. You know what I mean? It's only now that, enough victims can connect this way in a meaningful way to actually even be here doing what we're doing. So we're learning, on the fly, and dealing with, these technology issues I was mentioning. But still, people are finding us, and the one thing is we're trying to get as many of these videos as possible. And by us doing these Mondays and Thursday meetings, it kind of dovetailed nicely with people having one-on-one conversations with people to say, hey, I'm here to hold your hand, answer questions. A lot of these people really just, what we're realizing is just Facebook's not a place where you go to learn, right? So, no matter, people just don't know that we have this material that is required to understand the, the plan, the many steps of the plan. So to have these meetings, these open Google Meets, it was a great way to just kind of further that along. But a couple of weeks ago, one of the ladies also brought up how, intertwining this with our strategic partners, or who we're calling our strategic partners, and who we feel like, for different facets of the plan, we're raising money, at the charity level to provide to this community. And it's not to pay for people's rent or, because their muffler, they need a new muffler. It's going to be for things that aid the mission, how to reveal this thing, how to change it, how to get people back with their, with their kids. Okay. With, and since we're not, the laws are really broken and the courts are broken, what else is out there to, to make this point, make this something that they have to deal with. And one of the things that, happened upon us here is just this tie-in. And I mean, I knew Dr. Amen from years ago of just studying everything with my hedge funds about the behavioral sciences, and, read his books and watched his TED Talks on more than a few occasions, and listened to his passion about, what can now be seen. From these, and I will admit my ignorance. I haven't done my scan yet yet. I've heard many great things about it, but I did a lot of research as well on CTE, and was very convinced that, I looked at, the data points into CTE, and I was a hitman on my college football team. So that's the equivalent of like 150 car accidents I've been in. And I've got a theory, guys. I got a theory that just like muscles, the more you break them down, okay, they build back up. Right. Well, I'm hoping that's what happened to my brain. I do know that sometimes you can damage your brain and it just doesn't make you smarter, but I'd like to not think that I'm not so stupid. So that's the truth that I prefer. But the reality is this is how this all dovetails in for Marla being kind enough to, and friends from the Amen Clinic here, to be available to us to just throw her into the mix for a little Q&A, because it just kind of mentioned how, wow, okay, not only do we have what I'm doing on this side is showing this is the definition from my expertise of what's financial fraud in the financial world, and this is what I see going on in the family courts. And I know the Amen Foundation is not specifically designed to be against the family courts, or wants to be neutral in that effect. So I'm just saying, this is what we're doing on the science side of things, okay, to bring science into the equation, to, you know, kind of help us in this one initiative. But our dual mandate, okay, thankfully, is to help our, you know, our community, you know, get a little bit better every single day. So again, having these brain scans from Dr. Amen's organization, to sit there and show what I've heard, which is the most incredible data point that just jumps off the page at me, is, you know, that, oh my God, there's this actual physical science that can show that it's the same effect in the brain, or the same damage, or however you want to correctly call it. But, you know, just helping people understand that there's such material damage, you know, that the concept that it could be the same as a rape victim, right? What we've gone through. I mean, I think anybody that has been through it doesn't bat an eye at that, you know, concept, you know, but certainly the normal people out there, I don't think that that would be common knowledge by any stretch. So with that as the backdrop, you know, I'll just end by saying, you know, we would very, very much like to continue to support all the research that we see coming out of the Amen Foundation that is, you know, also echoing what we know and have seen and feel on a daily basis, that this is, you know, material damage that has happened to us, you know, and to the extent that that can be shown in real hard science is fantastic. That's why, you know, it is a top priority, you know, for the organization, as I'm starting to align, you know, where monies will go. Okay, our support is going to be, you know, kind of divvied up, you know, coming in again. You know, 6 months ago, this was an idea. You know, 3 months ago, this was 300 people in here. You know, and here we are, you know, in all these different countries, and with this movement happening here, that, you know, who knows where the end is with all of these, you know, with all these victims that we know are out there. So hopefully we could be, you know, this could be part of, you know, a little bit of thing that pries the door of the cage door open, so that some real change can happen. So with that, I will hand it over to Marla, and she would maybe take some time to kind of take it from there, and add to where, you know, she thinks your organization can, you know, can fit with us long term would be great.
Yeah, Dave, thank you so much for that introduction. And I'd like to just make a mention to several of my team members who are on this call right now. I see Donna Lawani out of my New York clinic. I see Melvin Stove out of my Arizona clinic. I see Lisa Marie out of my Dallas clinic. I see Wendy out of my Chicago location. And we're all here to support. So Dave, if you could take an extra 2 minutes and just fully explain the organization and how we're here, why we're here, and what our end goal, main goal is with you and with all of these beautiful faces that I'm looking at on this screen right now.
Sure. Yeah, I actually, I didn't know there was that many on, but that's a great place to kind of back up from. Clearly, you know, my lovely volunteers here, of which there's about 25 that have come from all over the country. Basically, in a nutshell, I started this mission about 2 years ago of putting the pieces together that the courts, you know, where this was a more than a broken system. This was a system that was designed to work a certain way that was really hurting people, and I decided to go public. And I did it in an orthodox way. That there was a lot of naysayers, okay, but I was lucky enough to get coverage in the press, and figured out that there was a way to put these pieces together that could actually do something to combat, okay, what we've been up against. And I had a theory that there'd be all these victims all over the place, that this was a model that was being created. This may be uglier and harsher and not politically correct, but I just have to be honest with you. This is what we're here for, okay? We're here for truth and transparency, to break this ugly system that is the, you know, the family courts, okay? We can't really dance around that as being part of our mission, because it just absolutely is. But the dual mandate is is that we're really hell-bent on using this blockchain type system I've created with the, using the Facebook group as a blockchain, as a public ledger, and it's working like a truth verification machine. So we're getting verified victims out of this, and we're getting a community that we really care about, and it's really, as goes and dovetails together with the science that we know on the complex PTSD side, that that really community and hope, and not being isolated, and self-awareness, and getting the right kind of treatment for this is something that you can heal from it, and the tie into the benefits of that's exactly from a parental standpoint what your kids need most. We had Charlie McCready on a week ago as a guest speaker, speaking about that aha moment, okay, that no, your kids don't need to see you fighting like crazy, they need to see you well, okay. And so there is a humanitarian mission to what we're doing. Yes, we do want to hold culprits accountable, okay, in the family courts, but ultimately to bring families together, all right, and innocent parents that deserve to be whole with their parents, with their kids and their family, and just that. So with that, we are to just kind of jump in here that the Amen Foundation I view as one, integral, strategic alliance. You had mentioned that all of your data is public. Okay. I would like to be able to support and push and promote, your research, because I'm a believer of it. We're not asking for any money, okay, from any of our, in fact, we've committed to never ask our victims for money. All right, I'm gonna ask half of Wall Street for their money, but there are things that cost money, okay. We're all 25 volunteers. I put out one PSA 2 months ago saying I'm looking for volunteers, and these lovely people came forward and are working harder than anyone I've ever had work for me on Wall Street, because of believing in this mission and what we're doing here. For me to lay out to you, Marla, a 5-point plan of where we're going and having everything mapped out is a very organic thing. We're in hyper growth, so I don't know the full answer to that question. But all I do know is everything I know about the Amen Foundation is we think alike, okay, from a humanitarian standpoint, and what you want to use this information for, all right, to do good in this world, okay. I think we're on the same page there, and then I think the rest we can figure out.
Beautiful. I like the way that you put that. Has anybody here heard of Amen Clinics before this call today? Yeah. Yes and no. I'm seeing yes and no's. Okay. I'm going to share my screen and bring up a couple just important topics. And we're going to talk trauma on 3 sides of things. We're going to talk trauma, whether it be physical, chemical, or emotional, and how we can clearly see damage that has been done to the brain in all of these capacities. So I am the manager of legal and forensics at Amen Clinics. And we started this program several years ago in being able to take brain SPECT imaging scans, which is what we do. I'll share my screen in just a second. That's single photon emission computed tomography, taking the images of the brain, taking them into court and proving the damage that has been done. Again, whether that's chemical, physical, and or emotional. Now, the second side of this is we provide treatment and treatment plans and options for individuals across all 11 of our clinics. We are nationwide. So we help with ADD, ADHD, anxiety, depression, Alzheimer's, bipolar, schizophrenia, traumatic brain injuries. We are a brain health clinic here to provide support, options, resources, scans, and treatment plans for individuals that are struggling in any capacity. And nobody deserves to be struggling with any of the above things that I just mentioned. So I'm going to share, fingers crossed this works. Again, this is my first time on this platform, so let's see what happens. And I want to start from the beginning. And
you're a pro, Marla. It's done. It looks gorgeous.
I know. Hang on. It's just not pulling up from the beginning. So let's anybody knows how to help me, that would be great.
You might have to go out to the page, Are you on like the main screen right now? You're not gonna be able to click from the actual Google screen.
I'm sorry. On the right side, there's a scrolling bar. Why don't you try scrolling all the way to the top on the right side with your scrolling bar?
Right here.
You see how go more towards the right, all the way to the right of the screen. There's a scroll bar.
It's not scrolling for me, people. It's not scrolling.
Yeah, I think what's going on is
Or
that
your arrow button.
that's
up.
pulling your that you're choosing which screen, right? When you hit share, okay, you've got an option to, do you want to share from where? From an actual one of your other screens, from a specific program? Depending upon what you selected when you hit share. What I like to do is just have it up on a whole other screen, and then I just share the entire screen. But
I
So-
selected my PowerPoint that I completely wanted to share. And 99.9% of the time outside of this platform, it pulls up for me. So we're going to continue talking for a couple of minutes. So, Eamon Clinic,
Your
I think
your
that
app-
was screen share as well
might-
from my end.
you might want to read
what's that?
the program. Yeah.
Donna, what'd you say?
I could certainly screen share some related content that I thought might prove helpful from my screen. I do think at the top of your toolbar where it says slideshow, if you click on that, it may be able to allow you to navigate and show that. If you
Alright,
click
let's
it
try that.
before you share,
Before I share.
yes.
All right.
Check over to slideshow
try
and start
that.
from the beginning.
Let's try that.
yeah,
And if that fails, I can certainly share, from my side and we can talk.
I think the key is really when you hit that share button at the bottom for the very first time, it gives you options, right? And you got to look at both tabs. The tab on the right is entire screen, which I always do, because then you just have to modify your screen. So whatever's on your screen, you're moving your screen around the way you want. But if you just click go, you might not realize that you had options. But you know what? I'm gonna while Marla's playing with that for a second, I'm gonna give her 2 minutes to just work on that and interject and back up, because her professional presentation right there it reminded me of a few things, and I'll give her a minute to catch up where she needs to be and hopefully add some value with this, in that it really pays to sit there and really think through and have an organized presentation about bullet pointing the many things that this is about. I mean, it's all about brain health. Okay, it's not just, that's not the only thing they do is do these brain scans. It's a brain health clinic. And then the alignment here is, I mean, from a percentage of people that are in our group, okay, that are affected with real serious brain trauma, okay, it's darn near 99%. Okay, if you definitely suffered trauma, all right, whether or not you're affected, to the extent some of us are. I have no question to know that I absolutely, even I got my kids back 14 months ago, my PTSD has gotten much better, but it's not fully. I still get triggered, okay, and I see it on a daily basis. I mean, no one's speaking to more people. I spoke to about 300 victims over the past 6 months, okay, and I'm saying from the bottom of my heart, yes, this is something that has affected all of us. It's universal. I'm not going to sit here and sugarcoat it. It's affected some people. Some people it's debilitated to the extent that they really can't have a lot of other things in their life, including work and a job or anything like that. But almost 100% of people are debilitated, are affected by this, and which is brain trauma. Okay, so a brain health organization really aligns with, I believe that we're both in the same business.
Can you use your arrows to go through the different tabs?
I cannot.
What about at the bottom? You see how there's a right arrow and a left arrow? Can you try to click those?
They're not clicking. But what we're going to talk about is the role of brain SPECT imaging in talking about traumatic brain injuries, whether they be chemical, physical, or emotional. So I'm going to stop this because it's just not working on my end. And I'm sorry, I can't click anything up, down, left, right, backwards, sideways. I will be able to send full information to everybody along with images. So what I had on that PowerPoint, what I have on that PowerPoint is who we are at Amen Clinics. Dr. Daniel Amen started Amen Clinics 35 years ago. He's a veteran himself and started in the military, and seeing that psychiatry was backwards because everybody was so quick to throw meds at a diagnosis of ADD, ADHD, anxiety, depression. And Dr. Amen 35 years ago said, whoa, 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 wait. We're treating an organ that we're not looking at. And that's not standard. That's not typical in medicine. If you're having liver problems, your doctor's going to image your liver. If you're having heart problems, your doctor's going to image your heart. Lung problems, the same thing. But psychiatry, things were backwards. So that's where we started with Amen Clinics, brain SPECT imaging scans, imaging the organ that we're exactly treating. So what we can do at Amen Clinics is we can pinpoint the root cause. Donna is so brilliant. It's unbelievable. Donna is the smartest IT person on the whole entire team, and I'm not. And that's why she and I work so well hand in hand together. But what she's pulling up right now is exactly what I'm clearly talking about and what we're doing with brain SPECT imaging, right? If you're having crushing chest pain, your doctor's going to image your heart and your chest. Your lungs, the same thing. But the anxiety, the panic, the PTSD, the trauma that's involved in the brain, we're not imaging these things. And it's not working properly, and people are not healing the way that they should be. And that's what we do. Are all of you in New York, or are all of you from across the country? All over the place, all across the board. That's fantastic, because we are West Coast to East Coast as well, with 11 clinics across the country. We do have one right in New York City, DC, Atlanta, Miami, Dallas, Seattle, San Fran, LA, Orange County, and Phoenix.
Any in Canada or the UK or Australia?
Closest would be Seattle for
Western, Seattle. Of course, sometimes for Chicago or for New York. It's about an hour flight in if folks are coming from Quebec or from Toronto, other parts of Ontario.
Great. Yeah, they so in the group here, I don't know if there's any in the call, but significant contingent from Canada, England, and New Zealand, but Australia and New Zealand is far from everywhere, so I think I'm sure they're used to that. Marla, do you have you've got such a wealth of information on the website from all of the studies. How many of these brain scans have you guys done, and what were some of the bigger realizations that Mr. Amen Dr. Amen has maybe cited more recently, as far as what they've learned from emotional trauma, and that shows up in the brain?
Mm-hmm.
So to date, we've done 250,000 plus brain scans. That's a lot of brains that we have seen over the years. And Dr. Amen has done several scientific research papers on distinguishing trauma in the brain and clearly looking at traumatic brain injuries in comparison with emotional trauma, with physical trauma in the brain. And your screen's not flipping, but the diamond pattern, that's what I had on my PowerPoint too. We can clearly see the diamond pattern in the brain. When we're talking about PTSD, which I think a lot of the members of this group are dealing with. And, it's approximately 3.5% of the population that is dealing with PTSD. And that's post-traumatic stress disorder. My kids were taken away from me. I lost my money in the divorce. I was raped. I was abused physically and or emotionally, which can lead to PTSD. And this comes from childhood abuse, from traumatic events, rape, sexual assaults, repeated violence, exposure to violence. being stalked, watching someone be seriously hurt or killed, injured right in front of you, being held at gunpoint, the sudden death of a parent or a child, life-threatening medical situations can all lead to PTSD. And what we do at Amen Clinics is we bring our patients in so we can clearly see what's transpiring in the brain, what's overactive in the brain, what's underactive in the brain, what's working properly in the brain, so we can pinpoint the safest, most holistic treatment plan moving forward. I'll give you an example. I have a family of 6. Literally right this second, they are on an airplane flying from Alaska to my Reston, DC clinic. This family, rape, physical abuse, divorce, financial abuse, stalking. They're coming in for a clear picture and a treatment plan for all of themselves. We have a case that's all over the media right now, by a reporter who's a very mutual colleague of Dave and myself. And it's a family, similar situation, a mom, her 2 children, physically assaulted, sexually assaulted. We have been able to prove the trauma in the brain for court purposes to, fingers crossed, keep the family away from the abuser themselves. That's what we do at Amen Clinics. We image, we pinpoint the root cause of what's transpiring, we put our patients on a treatment plan, and then we can help move forward if there are court situations involved to show the damage that has been done. And I'm going to pause for a second because I'm about to sneeze because I have a cold. And I'm going to allow anybody to ask questions and or Donna to jump in if she has additional images that she wants to show, since she has the ability to show a PowerPoint.
And I just want to interject for a second. Anybody, we got a big group with us. Anybody wants to ask a question, use that little hand thingy at the bottom. All right, click on that one. That puts everybody in a nice little, line so we can be, develop.
You have Doug as a
I
number
see
1.
Doug. There we go. Hi, Doug.
Hey, can you guys hear me?
Yeah.
Sweet. Do you do scans on the children who have been abused to help prove their story?
We do. And we can scan as young as 4 years old for the littles.
Okay. Because we have an 8-year-old that isn't being believed in the court and has absolutely no voice and was taken away from my wife. And so we really need help.
Well, I think that question gets to my another way to kind of bring it up 30,000 feet. A lot of what you guys do at the Amen Clinic is obviously individual work, individual brain scans, individual treatment plans, around brain health, for each individual patient. And I'm sure it's so customized that it's different from, from patient to patient to patient. But from 250,000 scans, is there much research out there? Have you compiled numbers around different, does a kid, somebody who's criminally insane, okay, a stalker, an abuser, does something show up in the brain different and distinguishable versus a victim of their abuse? Because if we're wishing upon a star here, that of some magical final innovation that will actually bring truth to our world, nothing could be more dramatic than that. Is there, to your knowledge, is there data on this at all?
So yes, we do have case studies on both sides. There's a case study, Donna, I believe it was when Dr. Amen scanned the brain of an individual that had assaulted and possibly even murdered several individuals. And I don't have statistical data on exactly what you're asking for, Dave. I don't have that broken down. No, not in those specific numbers for somebody proven to be criminally insane versus those that are proven to be abused. But we can show, and yes, we are going to see a difference in the brain from somebody who has committed these horrible crimes versus somebody who has been the victim of these horrible crimes. But I don't have numbers
If
for
someone has had the propensity towards violence or their own brain injury affecting their decision making, if someone has poor judgment, insight, filter, or inability to control in the frontal lobe, if it's not treated, certainly, including with the areas of insult or injury to temporal lobe, that person might be more inclined towards aggression. Not always do we end up seeing that. So it is helpful to qualify for that individual from their background, their clinical history, other aspects of assessment, neuropsychological assessments and testing, quantitative and qualitative data. But imaging can help us to see areas of overdrive. For example, if we talk about someone who is not treated with ring of fire ADD, we often say, if you put this person on a stimulant, the behavior is going to get worse. And so you can have uncontrolled episodes, irritability, and perhaps propensity to strike out. So there are some individuals and cases, I'm thinking if I don't have the one that you're referring to, including with Andrew, but it is important to look in from a brain systems perspective of what's driving the behavior. But often those who are the individuals that affect others or perpetrators are not the first people who seek the help themselves, right? It's often those who are impacted by, as a byproduct of that behavior or those interactions. And so sometimes collectively, it is possible that we see people come in together as part of the healing journey. But from a brain systems view, it is so important to notice that even with identical twins, there are unique types of impressions and biomarkers, information that we'll see from imaging.
Understood. Yeah, that actually sits better with me, because this idea that, oh my God, it's a pie in the sky, innovation that is going to be the savior to everyone's problems. It was harder to sit with that because, I don't know. It makes total sense that it's just one more piece of the pie that if we're able to, and the tie-in, we're going to go to Jim next, Nota. The tie-in that we're trying to do here is we're trying to bring in, there's been significant noise and information around the use of the ADA in our world, okay, and especially having ADA a combination, for our entire group, okay. There seems to be some more legal teeth around the ADA, and it hasn't been fully explored as a means to protect us and help us in our plight. And if, for example, through ADA pressures, okay, we were able to order in a court of law the brain scans of both the culprit and the target and the patient, it could be very valuable information to sit there and say, well, look, we know we have the brain science to show someone who's got damage to their temporal lobe when mixed with a stimulant, okay, is known to have violent outbursts. And guess what? This person has this type of brain, and we know from the drug tests he's been on drugs. So therefore, and then now this child patient, okay, that has been the victim shows only the signs of what other victims, okay, of rape victims, of only, victims of abuse, of trauma have shown. I got to imagine that would be a game changer in a court of law, in a functioning court of law, right? But I just want to give people a sense that this is the idea of putting these pieces together. Right. This is what we're thinking as we're organically getting together and having brainstorm sessions like this, which is really what we look at these things to do. Jim, you want to jump in there? You had a question.
Is there a way to turn on the chat messaging? Because I do have an article that I can share with everybody on the topic we were just talking about.
Yes, I will.
Andrea can assign it to you, I believe, or open it up.
Bottom right, it says chat with everybody on the Google Meet.
It says chat isn't available.
It doesn't like you, Marla.
No, it's probably shut off. It's probably shut off so that we don't have everyone chatting like crazy. Yes, I'll turn it on right now.
One thing we deal
Okay,
with.
it's on now.
You see it open?
It
There you
should
go.
be working. Okay, perfect. Thank you.
And she's got that. Okay, so yeah, we got that. And is that something that people can click and save to their own computer so they can look at later?
Absolutely.
Okay, great. Let me just kind of wait, I need to move back to the hands over here. Okay, Jim had a question.
Yeah, just geographical. I saw you had a little dot in by the Chicago area, but then it didn't say Chicago. Is it Bannockburn? Is that your office or is it closed? Is it open?
Bannockburn's open.
Okay, cool. Thank you.
I can't see the queue right now, so somebody else choose who's next in line.
Shannon is next.
Shannon?
Can you hear me?
Yes.
Okay. I was just wondering if you could tell, like, if you see that the brain has damage, how would you know if it wasn't alcoholism or that it was emotional versus maybe other things that could cause the brain not to look normal? And then the other question would be, I think it's called EMDR therapy. Is that something y'all do, or did I even say that correct?
You did, yes. Eye movement desensitization reprocessing. Yes, that is another type of healing therapeutic modality that some counselors provide. There are several clinicians in our team that provide EMDR and other offshoot, but sometimes people will provide local access or seek care and in the evaluation support for local referral or someone that they can see online for appointments. So it breaks down some of the geographic barriers to access for care. If someone is in another area, they can be seen virtually. Mm-hmm.
But how can you tell the difference between maybe it was brain damage was caused by alcoholism or from the PTSD of, you know, of parental alienation or something like that, or divorce? How can you tell that?
There are different patterns and markers that functional SPECT imaging reveals, both from surface views, which is in the top register, looking at a more healthy top-down view, versus others that you start to see maybe scalloping or toxicity, other related impacts. This is with alcohol. So it looks very different as compared to the healthy SPECT scan. But also the inside engine of the brain. In the bottom register, we're looking at 3D images here, mind you, but we're looking at it from this visual sense without a 3D display. I can only show you right now from the stills. But this is showing you the inside activity blood flow views of the scans. So just like where we looked at previously, areas of PTSD, the basal ganglia, and there are two of them on the left or the right. There's an area called the thalamus, the brain's pacemaker. Sometimes with the basal ganglia, there can be sometimes inward and outward presentations of affect, of anxiety, or even panic. And the cingulate gyrus, sometimes with stress or trauma, it encodes in the brain. And so we work with different therapeutic modalities to dephosphorylate these chemical changes, biochemical changes in the brain that are charged with past emotional traumas or our inability, including in the cingulate gyrus, to let go of those moments or those events. And sometimes people come in and they're very flooded, or they are trying different therapies to talk about it, maybe with cognitive behavioral therapy. And their clinician is also saying, it isn't time to talk about it. We need to do some EMDR. Sometimes the EMDR therapists may say, too, we're not treating from the root. If someone has also had an unknown head trauma, they may not work with someone to provide the EMDR therapy. You have to attend to the injury of the brain. So it is so important to know someone's background and clinical history and be thorough in areas of assessment to be sure. These are the areas that we were talking about, distinguishing brain injury. So anterior sections of temporal lobe prone to injury and insult, even this area in the inferior orbitals of the underside of the front part of our brain. If we're touching our forehead, this is the frontal lobe of our brain for the executive function. And sometimes under stress, also with depression, these areas can go low in our areas of neurotransmitter function. So it is a part of a communication relay system. Our brain has to serve us well to be vigilant and hypervigilant to keep us safe. But if it's overcharged and not serving us well, we have to be able to function in life. The brain cannot survive in overdrive or over rev. Cortisol levels of stress hormones are firing. And we do know that repeat stress from charged psychological and emotional traumas can be just as harmful for neurons and neuron death in the brain as with brain injury. So we can see this with greater specificity and then better target how we come along with different therapies. So that's a really good question. I hope I answered. And
Yeah.
is there anything in addition, Shannon?
I'm just curious what your therapies are, but I don't want to dominate.
So there are clinicians in our practice that may be able to provide at some of our various clinics. EMDR, CBT, work with children, adults, some who have brain spotting training, some of our doctors as well, even with havening technique that is less of a therapy, but more of a technique for some trauma-focused support and help for pain. So again, it helps to discharge some of these emotionally charged areas of the brain that are activated and helping us find greater emotional regulation when we go between sympathetic and parasympathetic and back and forth. It could be hard to find regulation with breath work, hypnosis. We do also have a hypnotherapist on board in our clinic in New York that also sees people virtually. So there are various modalities.
And we're going to go to, thanks very much for the question, Shannon, and a very, very detailed answer, Donna. We're going to go to Derek in a second, but I'm trying to think of like what questions and people coming at this from different sides of the equation and walks of life or whatever. And maybe not everybody has had the years and years and years of therapy or reason to have this kind of psychological study to even have a lot of the basics or even the terminology down. So, just to kind of go over some of the biggest signs of people that have trauma, okay, to the brain, whether it's CTE, okay. I know from doing all the research, for just, my suspected CTE, which is really just another form of traumatic brain injury, you know what I mean? It just happens later in life. But, for this crowd and for this group here, I think maybe to understand, to see what you might recognize yourself as is the common signs are hypervigilance, right? Like you can't relax. You are just hyped up all the time and super, you cannot let things go. You're ruminating in your head constantly, to an nth degree. I mean, we're all hypervigilant at times, sleep disturbance, okay, on a chronic basis, irrational anger outbursts, okay, problems with your memory, all right, impulse control, maybe just jumping to conclusions and jumping to see red, in a millisecond, and just overall emotional regulation, just having your emotions, kind of up and down. These are kind of the core things, involved in, don't I, possibly have, PTSD or some form of a complex PTSD, or potentially, again, who remembers every bump on the head? You know, how many times are they finding that people I didn't even remember? You know, yeah, I bumped my head pretty bad in that car accident or this or that. You know, I mean, you see people with brain injuries that seemingly had like one car crash in their life 20 years ago, you know, and they look like they're an NFL player when they do their brain scans later on. So with that, we're going to go over to Derek's question.
Hey everybody, I'm afraid I missed the first 10 minutes. So I find this whole thing very interesting. And I noticed that Marla said that the Amen clinics, and before I was even involved in any of this stuff, I did a lot of TED Talks listening to it. And there's this guy on here, his name is Daniel Amen, right here. And basically, he has a TED Talk on there that was done 11 years ago. And he explains a lot of different things that you guys are talking about right now. And I'm not sure if Marla went over that earlier because I wasn't on the phone call, but
Yeah, that's the very same Daniel Amen that runs the clinic.
So if you look at this guy, if you Google YouTube on TED Talk and Daniel Amen, his brain spectrometry thing will come up, and you can view that over and over. I've listened to it a few different times because I'm always interested in that. You know, as being a medical person, a nurse, I had to work along with people that had psych issues, and I never even knew that I was living with one for over almost 2 decades. So I've been thrown into the ring. So I've seen the different personalities. I've seen the different roles of the family, whether it be the sisters, the brothers, the separated people. I've seen all of that, and I didn't understand it because I was never around it. You know, my parents are still together, and that's what I was hoping for my kids. But I had an opportunity to see this, so I find this very interesting. And thank you for bringing this awareness to everybody. That's all I wanted to say.
Great. Yep, that is the very same Dr. Daniel Amen that they all work for. You know, it's his clinic, it's his organization, and yeah, that was about the time that I first discovered Dr. Amen, is from that TED Talk 11 years ago.
I think everybody should watch it. Definitely.
Yeah, I think that's definitely going to be some of the, you know, we're planning on utilizing quite a lot of the Amen Foundations, you know, especially as they do more and more studies about different classes, okay, and groups of people with these 250,000 brain scans. I mean, in my world of data, nothing is more valuable to that. I understand there may be, you know, pushback because may not be an absolute science aspect of it, you know, 100%, and then there's legal considerations in there. But certainly, you know, getting to the point, could you imagine if when, you know, Dr. Robert Hare did his psychopathy checklist, developed his psychopathy checklist by studying the 100 most famous psychopaths, okay, that he could find for 10 years. Right? If at the same time they were able to do brain scans of those same 100 psychopaths, what would have been learned, right? So we're at the dawn of this thing, right? I mean, he might have done that TED Talk 11 years ago, but I'm sure the ladies at the organization will say that, we're at the early innings of this science and understanding of everything. So Christine Knapp has got a question next.
Yes, I do have a question. With children who have possibly had any kind of traumatic brain injury and they are misdiagnosed as ADHD, oppositional defiant, and medication is prescribed to that child, can that cause side effects and different behaviors in the child and be misdiagnosed as maybe a parent was the cause of it or something like that? Because I'm seeing a lot of that in my CPS cases. And with this, I'm wondering if it could play a factor into it.
Absolutely. And the misdiagnosis is very common. It's not normal, but it's very common. Dr. Daniel Amen has a seat in the White House as we speak, currently working on the Brain Health Revolution initiative, focusing on traumatic brain injuries. Traumatic brain injuries being the #1 cause for addiction, homelessness, anxiety, depression, and the misdiagnosis of ADD, ADHD. So as we talked about in the beginning, psychiatry is the form of medication that's not imaging the organ that's being treated. So somebody with a traumatic brain injury, undiagnosed, untreated, can present as anxiety, depression, ADD, ADHD, bipolar, schizophrenic can present and all of these things and be medicated for them and being mismedicated for them when the underlying root cause could be the untreated, undiagnosed traumatic brain injury. So Christina, yes, you're seeing this because it's very common, but it's not normal.
Yeah, it would just, I see where everyone's head is going, right? How can these brain scans be used to fix these incredible horrors that we see? You know, we see over and over and over and over again. It's really refreshing to see that what people need to understand is they're not just in the business of these brain scans. Dr. Amen, if you watch any of his stuff on YouTube more recently, not the 11 years ago, he's a bit of a pioneer in calling out, okay, these kids should not be all drugged up.
Mhm.
I don't know how many people are out there saying, stop giving these kids, medications, but he is, and he's in the White House and stuff. So, we're kind of on the same larger than life mission here. If we're not seeing these direct linkages, right now, it's not from a lack of trying, I believe, out of this organization or Mr. Dr. Raymond having his eyes not set on the right things. Okay. With that, Chris Naylor is next up here. He's got a question. And before you get going, Chris, I just want to say, man, I saw you trying to defend me, to that troll site, those hired people and those stalkers that I have that are, constantly, shaming, trying to, just doing everything in their power to make us fail. That's pretty obvious here, right? But I just want to remind everybody, please, from a strategy standpoint, don't engage these people. I'm handling it. Okay, I don't want them. They're relentless. You don't need them. Searching who you are and just getting in your business left, right, and center. Marla had brought up, in the beginning of this conversation about cyber stalking, okay, as causing PTSD is something that they're seeing. We see in other areas of science, Jonathan Haidt wrote that book, okay, analyzing all the data of depression and childhood suicide and all the suicides and mental health ever since Facebook went to mobile. Okay, from 2010 on, you see the numbers skyrocket, right? So I appreciate it, brother, but from a strategy standpoint and everything, I appreciate you having my back right there. But right now, don't engage, don't give him an ounce of breathing room. Thank you, though.
No worries, brother. They reached out to me. I just said
Okay.
one simple thing, and they attacked my personal messenger and went digging around and brought us stuff that not more people would put out. Yeah.
Chris, you're breaking up.
Yeah, is there?
What I said,
Chris,
it's over. Is
Chris,
when
we
you're doing-
can't hear you.
Yeah, hold on, one second, Chris. Is there another spot in the house that maybe gets a little bit better internet connect? It seems like you've got
We understand you at all.
It's we're not even getting every other word.
How about now?
That's much better.
Yes. Yep.
Okay. So when we're doing these brain scans, when you're doing it, are we being, how do I say this? Are we introduced to stimuli? So that, am I reading a case or about scan or during the scan? How is it that's applied to the?
It's
when
doing
that's
it
being
again.
done?
You know what? It's doing it again.
Hey, Chris, maybe what you could do is type your question out on the typewriter on the text chat. Okay,
That's
brother.
easy.
All right.
And my phone number's on there as well. So happy to reach out if we can't get this answered today, if we can't fully get the questions out. I heard scans, I heard stimulants. Those were the two words that I heard. I'm happy to answer any questions from any of you. My direct line is in the chat here. Dave knows I'm very reliable in answering my phone calls and my text messages. So happy to have a side conversation with anybody that does want and or need additional information after this call.
Yeah, and the only thing I will say, guys, we do. I mean, she's very, very generous, but she's an important, lady over here, and there's a lot of questions that we can answer, and a lot of these questions might have to do with our involvement or help, okay, with our members with regards to this. So run your questions through, the moderators first, okay, and if there's, some greater insights that we can grab Marla for. But she's usually on a plane a few times a week and all over the country every time I'm speaking to her. So we want to make sure that we're respecting her time too.
There is a question if insurance companies cover these scans.
Insurance will not take us. We are not in network with any insurance company, not by choice. Insurance will not take us. Why? Because we're going to find the answer, we're going to find the root cause, and we're going to help heal the individual and keep this person from going back to the doctor or the ER or the urgent care over and over and over for the same thing repeatedly. We are going to pinpoint, we're going to find the root cause. We're going to put the patient on a treatment plan to heal the brain.
And while we're private pay, that does allow a lens of confidentiality. There are many individuals that may wish to see the results and their findings. And sometimes when individuals may come in, they may have only what the insurance has billed and shows current diagnosis, but sometimes there's new data and evidence and findings that we can see with greater accuracy. So that can help us better create new diagnosis codes for an individual. Just as we mentioned, sometimes the invisible injuries are now made visible. We have data and evidence. And if someone has had hospitalizations or repeat visits, other tours of treatment too, sometimes the insurance may be motivated to cover the scope of care for the assessment and the evaluation. And most of our services for comprehensive evaluations will have aftercare appointments that are included with it and a physician's follow-up. So this way we have a treatment plan and there's scaffolding and support of a patient outcome manager that will follow up and check in during the journey, but have 2 scheduled aftercare. Make sure that there's a follow-up with the physician, so that way you're attended to for check-in and follow-up needs and support. So our team, does sometimes hear that people may end up submitting to their insurance for possible reimbursement or gaining higher cost in the recovery after submission. But we do work with Care Credit. Many times people will use that just like for eyeglasses or for dental or dermatology appointments and such, but it's like a healthcare credit card. So we do accept that, and the plan too, even at 12 months, has a 0% interest. So it helps to make smaller payments while checking with insurance. But that confidentiality piece is nice because sometimes people want to see what are the results or my findings before I submit that to my insurance.
Well, I also want to thank you very, very much for clarifying that. I will also say from my neck of the woods here, everyone wants to also check if this is something you might need to save up for. If you work for a big enough company, okay, many companies offer what's called a flexible spending healthcare account. Okay, you could fund it with, I think, about $3,000 or something like that, maybe $5,000, where at least you're using pre-tax dollars, right? It's one of those use it or lose it type programs, but you can set up in the beginning of the year, say, okay, $50 a paycheck, okay, or whatever's going in, all right? And it's just as smart for a big expenditure that may or may not be reimbursable. At least you could use pre-tax dollars for it. But also I will say we're looking into other matters that a lot of people just don't know how to use their insurance. Okay, if there's been a traumatic event, if somebody's fallen off, okay, if someone's actively been physically abused and hit in the head and they've suffered an actual trauma to the head, that is a current thing, all right? I mean, that falls into another category of care. And if your doctor, writes the prescription and feels that, that, oh my God, this brain image would be critical to him doing his job and assessing whether you need an operation or something. There are cases where, we've seen greater, reimbursements, for stuff like that. But you got to get really into the insurance world, which we'll do. That's my world. Okay. So, we're going to look at every single avenue on that.
And
Thank
we
you for
find
the-
that 40 to 60% of our patients receive reimbursement from coming through the Amen Clinic's evaluation process. And we see these numbers increasing every day. We are just not, quote unquote, in network, which that was the initial question, but the reimbursement rates are high and they are getting higher. And Dave just made a great point. A traumatic event, a traumatic brain injury, a prior diagnosis from a doctor. Yes.
Yeah. And also, guys, understand, as we're running and making money at the charity, this is a top priority for what we'll help with too. Okay. It's not going to be, hey, you get a $5,000 scan, you get a $5,000. We don't got money like that. But, at least initially, it's definitely if people are putting away and said, okay, like I got a couple of thousand myself. Okay. Put away pre-tax to a flexible spending account. There'll be $1,000 in reimbursement. Okay. Maybe we could bridge the gap on that type of a thing. Just brainstorming right now about ideas, but this is, a top priority for everything that we believe. We're using science and truth. What is this? Okay. Brain scan is truth. It is the truth about what is going on in the brain. We are completely aligned on this. So Christine Knapp has got Christine, actually,
Chris's question's up in
Yeah.
the queue, so I'm going to read it. When the brain scan is being conducted, is stimuli introduced, such as reading something from my case, or good and bad memories, or music?
We conduct a test called the Conners Continuous Performance Test. It takes about 15 minutes, and that we'll call it akin to like the cardiac stress test for the brain. Usually, even with a cardiac stress test, you get the engine of the heart going, activated, whether it be on the treadmill or by activation medication. What we are doing is applying a test that while you're focusing, concentrating during the 15 minutes, the kind of rate of response may change, your focus, your attention. But with sustained attention, about halfway through that test, there's a small, minuscule amount with a pediatric butterfly clip that is applied. Sometimes people apply a numbing cream on the arm, even for children. So that way we have a small amount of Serotac that's injected. This is not a dye. And so it's a photon. So it's injected, minuscule amount based on your height, your weight, your body mass index, a minuscule amount. So this is used again in pediatric cases. It also is safe and available for adults. It only takes about 7 minutes of focusing and concentrating halfway through that test from the injection that we have the image of your brain fixed from that moment. So that way we can go back and relax and recline in a place in an open, non-confining area to do the 3D imaging of the brain. And so that allows us that window of insight to see how the brain responded during that task and concentration. And sometimes on a separate day or 24 hours apart, we may do a scan at rest to see how the natural idle of the brain is as compared with the times of activation during that Conners Continuous Performance Test. Sometimes that helps us with subtyping of anxiety or depression, ADD, seeing other areas of insult or injury. We've seen that, conditions even from anoxic injuries, near drowning, strangulations, other chemical impacts on the brain of substances that affects our decision-making and our processing and our response time. And so having those two comparative views can be so helpful to see the brain. So, I did see another question too, because part of our evaluation too are brain health assessments, quantitative and qualitative assessments with a detailed clinical history. Always want to understand underlying physiology. It's not just reading the brain from the imaging and the scans. We have to qualify what is unique to you and your experience. So sometimes people have had other neuropsychological testing or assessments, but sometimes these scans can bring to light other information that we can't voice or express. So that's helpful to give context to that.
Great,
And we're
Donna.
providing the treatment plan in the scope of what you individually need or your loved ones need in the healing recovery journey.
Right. Donna, also, this question from Abe Peachy kind of speaks directly to your line of answering right there, which is, he's basically asking, okay, from a diagnosis standpoint, clearly you are going to do all these different assessments and have a post plan and a pre-plan and an in-between plan. Okay. But, if you're bringing somebody in that it's getting, and you're doing this brain health assessment on them, and they have or have not been assessed by psychiatrists, okay, or they have a diagnosis or they don't have a diagnosis, will you actually do assessments from a diagnosis standpoint that could maybe be used and help people in their case where the only thing that they've been subjected to is parental alienation, and then now their brain scan shows that they've suffered trauma? So if they haven't had a car crash, they haven't played football, okay, and hit man on their kickoff team, the only thing that they've experienced in their life is parental alienation, non-physical abuse, that their brain scans are showing, the same trauma that you see in physical trauma people. Do you guys go so far? Do you get involved in diagnosis as well? What is your policy on diagnosis?
Mm-hmm. The clinics do provide diagnosis. That can be so validating to provide that data, including for cases, but also the pathways for the care and the treatment that need to be attended to. And often the treatment plans are very robust and comprehensive. So if there are other identified, let's just say underlying, concerns that may come up, since you also brought up concerns related to sleep issues, what else may be a driver for that? Sometimes we do look at other medical related needs. If there's something inflammatory or neuroinflammatory, that may be a driver, something vector borne, or if there's parasitic or tick-borne infections, viral insults, that there's certainly other data that can be so helpful from what we see to treat that alongside in hand. So it's not just one thing that we would recommend. It's a robust treatment plan of multiple things that would be phased in, individualized for your care in the weeks and the months that follow. So these are just some of the areas of the related specialties from an integrative lens as a brain health clinic, which means to really look at the root cause. There are different sleep issues, and to the question of encephalitis or encephalopathy or inflammation, there can be toxic mold exposures, other related conditions, bacterial, viral, that can be inflammatory to the brain.
Thank you.
Chemicals as well.
Thank you very much, Donna. I definitely have a better appreciation for when I'm sitting down with clients and talking about PEG ratios and regress analysis. When you're involved in this leg of the science end of the world, there's just a slew of terminology, and especially in their world that you guys might not be understanding right off the bat. Okay, it can be some pretty complicated stuff, but I do think what was just said really deserves a very slow re-mention here, guys. Okay, this organization, a lot of places you go, okay, my mom kept going to the hospital over and over, couldn't get a diagnosis. Why? Okay, when you have a diagnosis, it opens you up to be sued, right? So a lot of places have policies. We just don't give diagnoses, okay, which is purely from their lawyers, right? But this organization, okay, and psychiatrists also will diagnose you with PTSD, okay? I have not found that they have been shy about that. But now you have diagnoses from both sides of the equation, right? And the only thing that you suffered is parental alienation, all right? And now you've proven it. And even from this side, one of the top doctors, one of the most well-known doctors, TED Talk doctors in the world, his organization has diagnosed you with this PTSD, with this physical effect on the brain that shows in a scan, that, okay, in a functioning legal process, you got to figure is powerful, is really, really powerful, especially if you're trying to protect your child, right? You're trying to establish, a safe environment there. This is something that the more I hear about it, the more it clicks, guys, more clicks. So let's quickly, Christine, because you asked a question before, let's go and run to Chris Broughton first, okay? And then we'll come right back to you, okay, Chris? Are you muted?
Sorry.
I think Chris is gone.
Chris?
No, he's still there. Or
She's there.
That's you, Chris. Go ahead, you got a question?
what? How you do the brain test if the kid is autistic?
For the kids, they said earlier that as early as 4 years old, as early as 4 years.
No, I meant if the kid is autistic.
Autistic?
Yeah.
Okay, yeah, autism. I don't think I heard.
Certainly, some of our clinics, can provide scans and also mild sedation. Our New York, California clinics, our Dallas clinic, Chicago, we have access to provide a small amount that will help with twilighting for sedation. And so having that can allow someone who might not normally be able to acquire imaging of the brain in order to gain a window of insight. So it's a mild type of sedation that's applied, and then you wake up from it and recover before returning home. But for autism spectrum disorders, we've had some individuals with different neurological conditions or behavioral where it's body in motion or uncontrolled tremors. And some individuals may be able to complete the scans without sedations, but we can always assess that, engage before on an intake to see who would be appropriate to qualify. So that's a very good question, but we do see a lot of children and adults with issues with their gut health, the microbiome, leaky gut, which has to be treated too. And many kids on the spectrum are disproportionately at risk. So it's important to seal the gut in order to have better brain health and function. And that can certainly affect behavior too.
Great. Yeah, I think you also meant not only to sedate the patient to get the scan, as far as lessons learned from the scans with regards to autism. Does autism show up? I would imagine it shows up different in the brain than trauma. Has there been much learned about autism with the work that you guys have done?
Absolutely. We've also published a study on autism spectrum disorders, looking at different patterns, inflammatory, toxic, injury, and related trauma in the brain. There are different subtypes to see. And just like there can be comorbidities with areas of executive function, impulse control, or ADD, or ring of fire, you may have different comorbidities that come up, different conditions that are combined. So it's a really good question. And we have a study that was published on that several years ago in 2017. So we're happy to follow up also and send you some of the related research, because Amen Clinics has published more than 90 peer-reviewed scientific published studies on the brain and behavior. So we'll be sure to follow up and get you a direct link to that.
And Marla's the quickest shot in the East Coast, because she's already posted it. The autism study is right on the message board here, guys. There's a lot of really good stuff. I'd recommend you hitting the old copy and save to my desktop or someplace so you have time to take a look at it. Certainly, if you have specific questions around autism or trauma or parental alienation, certainly dig into those. I've never found that to be a waste of time. Christine has got her hand up.
Yeah. How are we not diagnosing using these scans prior to prescribing medicine to anybody by just going to a psychologist? Because any other medical disorder, you have to get blood work, you have to get tests run prior to prescribing medicine. But when it comes to any psychosis, we are just prescribing the medicine. How can that even be legal?
You raise a very good point, Christina. And that's why I'm seeing more pediatricians, others that maybe they don't do the deeper dive on blood workup or labs or imaging to be sure. And why I see some who pump the brakes before prescribing, nurse practitioners, PAs, others in different, internal medicine specialties. Many as PsyDs, as psychologists that may have prescribing rights are pumping the brakes as to why they might want to have imaging to be sure to rule out misdiagnosis. Because you're absolutely right. There can be, side effects of medications if you put the wrong person on the wrong medication. And also for developing brains, we have a child and brain and mental health crisis with kids today. And we're seeing that flashover of acuity, with greater rates of anxiety, depression. We have to help support them as their brains are developing. And so we may want to look at what can come along in complementary medicine and also be more natural when it comes to nutrition, microbiome and gut health, functional medicine, and integrative medicine to help support those clients, or brain-directed nutrition if there's vitamin deficiencies to assess and then better treat for that. So you raise a very good point.
Great. And guys, we have thrown them into the fire here and taken so much of their time. We'll want to be respectful. They really have, given us such an unbelievable amount of time and resources, and the personnel that they've dedicated to this. I can't thank you guys enough. We are going to end on James, on Jim Sonoda. It's the last question over here. But again, guys, reach out to the moderators, okay? If you have very specific follow-up questions or want to get access to one of the many, we are saving all of, we have access to, and on the website, their website is a wealth of information. And I just sit there and say, guys, that it's just worth a reminder here to understand, the healthcare industry is a business, okay? Everybody wants to go to the doctor like it's 1950 and trust that this doctor has nothing but their client's best interest in them. But what have we realized? The reality of our healthcare system, right? You're going to a doctor and they may not know the Amen Clinic exists, right? That's why we have to know, right? Anybody that has had a real medical issue, you talk to them, they'll many times tell you that they themselves had to dig out the information and bring it up to the doctor. Hey, what about a brain scan? You do that and then, oh, okay, yeah, great idea. Okay, I'll write that, but don't sit back and just think that, this is all going to be done for you. We're going to be consistently putting out this healing series, an education series where brain health is going to be a constant thing. And you have my commitment. I'm not going to just put out anything. Right? It's not going to be like a newsletter, right? It has to be something that really filters in and is one of the top 1% most impactful pieces that I've seen in all of my research and coming in from all other sources. So if we're putting it up on the news feed, it's something worthy. It's something worthy of your time, because you never know. You never know when some of this piece of information you get on here and it's like, because you did this research, right? That connected a dot someplace, and talking about your health. What do we got if not that? So we're gonna end right after Jim's question, but from all of us at the Warrior Project, thank you, Marla, thank you, Donna, thank you, everybody from the Amen Foundation. We really appreciate that, and we hope to have a lot more collaboration as the months and weeks and hopefully in years go on. So thank you very much, Chris. Go ahead. Jim.
Yeah, thank you guys, and thanks for putting this on. And I guess my skepticism is coming out though too, Dave, and I apologize for it. But how how, and I know we're scratching the surface, but how are we proving that it wasn't, like, for instance, if I take my daughter, how do we prove to the courts that I didn't cause this trauma? Or also, if I have a brain injury, how do we prove to the courts that I'm still fit to take care of my child? Because this is something that has been used against me in the past already with just the diagnosis itself.
Yeah, before I let the guys from the Amen Foundation answer from their perspective, I'll say from the Warrior Project's perspective, I would say that this really comes in where it's one piece of the solution, right? You know, like your entire track record, we keep telling everybody your whole world is transparent. No one has hearsay conversations anymore. If you're being attacked and called, you know, a drug addict, you know, this or that, okay, I got the same exact thing. I made it a point to put up, you know, proof of me rock climbing in Maine, okay, when I know my kids were being told that I was, like, you know, in a dumpster in Vegas with a hooker, you know what I mean? And, you know, my daughter said, you told me that, but I saw that, and that's where we're saying, what we're doing is permanent public record, right? So be creative with your defense in that. I would believe that, you know, these brain scans, okay, showing, you know, it might not be that silver bullet, okay, not really looking at it being a silver bullet, you know, but as one piece of the transparency train that can, you know, lead toward truth. I think it's one of the most powerful tools in our immediate sphere, you know, to be working with, and certainly worth everybody's, you know, deepest consideration here. What would you guys?
And I want to jump in for 2 seconds on this one, James and Dave. James, we do a full clinical history with each and every one of our patients, where we get detailed information from pre-birth until now. So whether it's you coming in for the scans, your daughter coming in for the scans, we're going to have all of this information to go along with the proof of the imaging itself, along with the total brain assessment and the Conners performance test. So we put that all together in a nice little package to be able to show.
That's great.
And we have for those forensic psychiatrists on site as well that help us work through these cases from beginning to end.
Yeah, the biggest issue. The biggest
other
issue
care
we have.
team members too. Just to reference that, if you have other physicians, other psychologists, or child therapists that are working alongside, you know, we can collaborate and partner. And also, if they're included and permitted on release, we can get records or reports to discuss to better support care, because there's so many silos and gaps, as we know, in our healthcare system, and we want others to align in support for you and the healing journey of you and your loved ones.
So you have a lot more than just a scanner, is what you're telling me. Okay. Got it.
Sorry if I gave that impression. It was just what really jumped off the page to me as this really, really incredibly useful tool. But it is important to understand how and why it's so important we're talking like this to work together, because one is not the solution by itself, okay? Because even with the most definitive scans and analysis from one of the top doctors in the world, what are we left with in this divorce court? Another piece of truth that may not be getting attention, okay? We're always left with the question, who's listening? Who's listening to do something about it? If the judge just wants to say, oh, this is all proof that proves Jim's innocent, I don't want to look at that, right? That's why you need what we're doing, okay, to hold people accountable, right? It's not just one, okay? They need us doing our job in our world to do something, because again, it's just another piece of truth, of evidence. And one thing we know from our group here, we're not in this situation for a lack of evidence, right? We're not in this for lack of evidence, okay? But this science, that's more than just evidence. That's more than a text string, okay? We need to say, we still need people to drop it. How are you ignoring this science? Because at the end of the day, we need people to jump up and scream and you know, about how this information is being ignored. But I will say also, having Dr. Amen in the White House, okay, in these policy conversations, is a really good sign. Is a really good sign. With that, guys, we're going to respect their time. They've kept us for 90 minutes. Thank you so much, so much, so much, so much. Everyone, please thank our guest speakers who are taking so much time and lending so much expertise. And thank you very much. Have a great one. Guys.
Thank you.
Thank
Bye-bye.
you.
It's our pleasure. Thank you all. Our pleasure.
Did very good
Thank
job
you
on
very
the
much.
Oh, the IT side of things?
Yes.
No.
Thank you, Donna.
No.
Thank you
Not
so
me.
much.
Donna's my IT girl. I stink at that. But
Thank
thank
you.
you
Pleasure.
for bringing us together, connecting us.
Yes.
We just want to be of service to you, to your organization, to Dave, to those that need us.
Thank you so much. We really appreciate it. And I know all the parents do, even those that haven't made it on tonight. I know, I mean, I can only really speak for myself and my husband. My husband has been dealing with this and I've been walking alongside of him, but just, I know all the parents, like like having an organization like this come and even spend an hour or 2 hours with us means so much, because so many parents feel unheard, you know, especially from people that are in these positions of medical psychology, you know, all that. They just feel unheard. And like, because the courts, the way it's all set up, they just don't, it's like, we're the liars, we're the bad parents, and we're just, everybody feels unheard. And so just taking the time, I know it means, I'm sure I'm speaking for everybody on here, it means a lot.
Well, very well said, Amy.
Yeah, it means a lot.
Thank
So,
you.
and
Honored.
Chris, I sent you in your email the autistic things I put in your messaging. I copied and pasted them, so look for them, sweetie, in your messaging on Facebook.
I did. Thank you. I'm getting that to one my other friend whose son is autistic too.
Okay, perfect.
The
Awesome.
only reason I asked because they're going to do the test on my son now.
Oh, they are. Okay.
That's why I asked.
Well, you can always reach out to them too if you have more questions. Send them an email.
Yes, thank you. I really appreciate of all the stuff with all the help you guys doing. It's amazing.
You're welcome. Yeah. Anyone else want to say something before we sign off tonight? Oh, everybody's good. Well, thank you so much.
Well, seems like
What, Amy?
everybody's sick. I hope everybody gets well.
I know I'm sick too. I see Marla sick. I had like a fever for 3 days. I think I still have this like fever. I've been like, I was bedridden for 2 days and it's just not going away. My voice is horrible.
Self-care is so important in the journey and the
Yeah.
healing process. Your body needs that, your immune system does. And it's also very hard to heal if you're under state of stress. We know that.
Yeah. Yeah.
So double down on that arsenal for self-care and all the things.
It's-
that you
yeah,
need. Even sleep if you can.
Yeah. It's tough when you're being like attacked every day. You know, you're constantly on defense. But I try my best. Sometimes I'll try to just get into a book and just say, okay, for this hour, I'm just going to go into the story of the book, you know?
That's like a good plan.
Yeah.
Go watch a true crime series because it doesn't relate to your life at all.
I watch all that too.
It's like, wait, I don't relate to these people at all. This is perfect.
The moments of respite that when you can find them.
That's why it's relaxing to me, because like everything else, I see stuff that I'm like, oh, that reminds me. But a murderer doesn't remind me of anything.
Amy, only Amy. And then it takes you down the rabbit hole of what's really going on in the
I
world.
know, but it's not me. It's somebody else.
Well, have a great night, ladies. Thank you so much.